I can't remember a time before in my memory that I didn't want to do medicine. I grew up with my grandfather in India, who was a town physician, and he did everything. He did the surgery, he did the psychiatry, he did the internal medicine. He wore every hat, and he was beloved by our villages, and he went places in the middle of the night, and he was just everything for people who needed him. And I saw that growing up, and immediately I wanted to be a person who would be involved with families, who would try to give people comfort, ease their suffering. Started on my path through traditional training, kind of left residency, worked in very kind of a center in Boston that was had a lot of people flying in from all over the world with very complicated problems, and we were trained in a system that was different. Each month we had a different training for, say, kidneys, and for cardiology, and for hematology oncology. So everything kind of was separated, and we thought about the body in different systems, which isn't a bad or a good thing. It was just the way the teaching was excellent. We had great mentors, fabulous hospital system, but it was just that education was kind of fractioned in the sense of the body wasn't connected. When I left residency and started practicing, I realized very quickly that a lot of the things that I was doing as an internist wound up being things like putting out fires. So when I started my training in acupuncture, I realized the concept of healing, as opposed to putting out fires, doing more well medicine versus sick medicine, and treating symptoms versus the root cause. And where I quickly found out that the stress response had a big part of that root cause of people. Not the only cause, but when we think about what our choices are in life, we can't always control the town we live in, the water supply, the air quality, but we can control when we sleep, how we eat, what we choose to eat, how much we move, and what we're thinking about all day. So I found that was a huge part of how healing began, along with looking at the things I learned in functional medicine training, which was about the nutrients, the hormone balance, the biochemistry of the body, the gut, all these different aspects, which kind of give us a concept of how healing happens. Which is, as I was learning all of this, I understood that it was very difficult to do in the traditional model with a 10-minute visit. I opened up Shakthi 10 years ago, and since then, we have been trying to give people the medicine that I believe is true medicine, which is integrative. It encompasses mind, body, spirit. It encompasses stress response, sleep response, diet, as well as things where we use functional medicine testing to look at stool, to look at the microbiome, which is very, very important to our overall health, looking at our immune system, looking for toxins and metals and things that cause our bodies not to behave properly. These are just some concepts of things that we do, but overall we're looking at the big picture, the root cause, and we try to work with people and kind of create a relationship so we can personalize the care and not just to give kind of a rote response or something that's templated for a diagnosis, for say, like fatigue or fibromyalgia. There is not a cookbook recipe. It's basically kind of a work in progress with the relationship that's formed with the patient and the providers and our staff. And we try to be very thoughtful in terms of what we're testing for and how we're approaching things. But usually it's a very integrative approach.